Florence Nightingale's environmental theory. In watching disease, both in private homes and public hospitals, the thing which strikes the experienced observer most forcefully is this, that the symptoms or the sufferings generally considered to be inevitable and incident to the disease are very often not the symptoms of the disease at all, but of quite something different, of the want of fresh air or light, or of warmth, or of quiet, or of cleanliness, or of punctuality and care in the administration of the diet, of each or all of these. The Notes of Nursing in 1860, Florence Nightingale. Nightingale's assumptions. Nursing is separate from medicine. Nurses should be trained. The environment is important to the health of the patient. The disease process is not important to nursing. Nursing should support the environment to assist the patient in healing. A research should be used through observation and should explain the nursing discipline. Nursing is both an empirical science and an art. Nursing concern is with the person in the environment. Sickness and wellness are governed by the same laws of health. The person is interacting with the environment. The nurse should be observant and confidential. The goal is to assist the patient in his or her retention of vital process by meeting his or her needs and thus putting the patient in the best condition for nature to act upon. There are 7 environmental components essential to an individual's health. They are air, pure water, efficient drainage, cleanliness, light, chattering hopes and advice, and balanced diet. These are the 13 perspectives. Observation, personal cleanliness, petty management, light, health of houses, cleanliness of rooms, ventilation and warming, bed and bedding, taking food, what food, noise, chattering hopes and advice, variety. Health of houses. The importance of the health of houses as being closely related to the presence of pure air, pure water, efficient drainage, cleanliness and light. Cleanliness outside the house affected the inside. Ventilation and warming. Nurses was to keep the air he breathes as pure as external air without chilling. Nightingale was very concerned about noxious air or effluvia or foul odors that came from excrement. Nightingale stressed the importance of room temperature. The patient should not be too warm or too cold. Petty management. This canon involves the continuity of patient care when the nurse is absent, so the patient doesn't experience variance in the standard of care when a specific nurse is not on duty. Observation. The definition of an observation is an act of noticing something or a judgment or inference from something seen or experienced. Noise. Florence Nightingale has stated that patients should never be waked intentionally or accidentally during the first part of sleep. She asserted that whispered or long conversations about patients are thoughtless and cruel. Nurses' responsibility is to assess and stop different kinds of noise. Light. She viewed that direct sunlight was what patients needed. Although acknowledging a lack of scientific rationale for it, she noted that light has quite real and tangible effects upon the human body. Variety. She believed that variety in the environment was a critical aspect of affecting the patient's recovery. She discussed the need for changes in color and form, including bring the patient brightly colored flowers or plants. Bed and bedding. She stated that dirty carpets and walls containing large quantities of organic matter and provided ready for source of infection, just as dirty sheets and beds did. The nursing diagnosis, they are grouped under the environmental components. So there would be ineffective airway clearance, ineffective breathing pattern, impaired gas exchange, and so on. Nutrition and taking food. She addressed a variety of food presented to the patients and discussed the importance of variety in the food presented. So these are the nursing diagnoses for them. Chattering hopes and advice. She believed that sick persons should hear good news that would assist them in helping to become healthier in a better way. So the nursing diagnosis would be anxiety, fear, lack of knowledge, ineffective coping, etc. Thank you.